Relief could be on the way for those diagnosed with diabetes.
Yeah, this comes after Eli Lilly, a pharmaceutical company, announced it would be dropping the cost of its insulin by some 70%.
Pretty incredible. News 19's Nate Stanley has more on the impact this could have on you.
I have so many doctor's appointments already that, medical bills are already super high, and now we have to pay extra money.
An unfortunate added expense, that's what Gabby Hurley is facing after recently being diagnosed with diabetes, potentially having to pay an additional $60 to $70 per month for care. She joins a growing list of South Carolinians living with the condition and needing to purchase insulin. According to DHEC, 1 in 10 adults in the state have diabetes, another 1 in 10 have prediabetes. Shauna Hicks from DHEC says it plagues some of the state's poorest communities.
Some people, however, live in neighborhoods where they don't have access to that healthy food, or they live in neighborhoods where they're just rows and rows of fast food restaurants and that's their only choice.
According to Dr. Kay, an endocrinologist at Lexington Medical Center, it can be a costly diagnosis, one many can't afford.
People are unable to afford insulin. And it's sad because, as I said, for type 1 diabetics, that's the only, they need insulin. Otherwise, they cannot survive for too long.
Dr. K is celebrating, however, as good news could be around the corner for her and her patients. Eli Lilly, one of the largest insulin producers in the country, announced on Wednesday morning that it would be dropping the cost of insulin by 70% and capping costs at $35 per month. The company says it will do this by cutting its list price of its non-branded insulin to $25 per vial.
It's great news for all my patients.
Hurley is also excited by the prospect, hoping it can be a continuing trend amongst all medical expenses.
I don't understand how people who have, type 1 and type 2 diabetes and don't have really good insurance, I don't understand how they can really afford it. It's just crazy how much they charge for it.
In Columbia, Nate Stanley, News 19 WLTX.
Well, in January, the federal government started applying a $35 cap for insulin for those on Medicare.
And DHEC says that lifestyle changes, including regular exercise and a low-carb diet, can drastically reduce your chances of developing diabetes or becoming pre-diabetic.
All right, stay with us.